Hello everyone, this is Perwaiz from CVI 2023. I'm really privileged today to be with Dr. Perwaiz Meraj to talk about cardiogenic shock protocol and how to set up program. Perwaiz, always nice to see you.
Always good to see you, Shadi.
So as you know, shock never stops. It's going to be there forever. And the challenging is, what the improvement is in our approach to the problem, but it's still not homogeneous across all systems. So where are we now?
It's a great question. I think one of the most amazing things about shock is that it's heterogeneous in itself. There are no two people in shock that are the same.
Exactly.
Anyone who takes care of these patients knows that. And so you really can't do the same thing for the first patient you saw to the next patient you saw. And it requires a little bit of on-the-feet thinking. And I think one of the things that's really made the difference in shock is protocols, which in your neck of the woods is where it's all started in Detroit. So the Detroit the Detroit Cardiogenic Shock Initiative is really where everything started, and it became the National Cardiogenic Shock Initiative, thanks to Bill Neer and Babar, Basir, and so they have really revolutionized the way we protocolize the management of these patients. And I think the next level after that was shock teams. Bring other disciplines into the picture. So not just the interventional cardiologist, but the interventional cardiologist, the heart failure physician, the surgeon, as well as an intensivist, to really be able to truly manage the patient, because we may see the patient at the first entry point in the cath lab, but there's a huge amount of care that goes into the patient afterwards,
yes,
which can't be underestimated or underappreciated.
Yeah.
So it's really, I think it's, in the 14 years I've been doing this, I can honestly tell you that the way we treat shock today is not how I treated shock 14 years ago. It's a totally different world.
As you said, there's a lot of teaching and standardization of care that should happen. So especially the ICU, when the patient goes there, nursing education is very important.
Absolutely.
So is there any like a teaching program where we can, staff comes in or go to a program or something they can do and learn how to treat these patients?
That's a great point. So I think this has been one of the crux issues, I think, in those of us who live and breathe shock every day. We've all learned on our feet and all learned probably the hard way. And I think, like anything, CTOs, complex PCI, even just cath, when we learned it, there's no point making the mistakes that other people made. It makes more sense to not make those mistakes, to learn from those mistakes. So some of the programs that we're putting together, and I think Sky Shock is one of them that we're going to have in October. Shameless plug, please come. It's actually in Texas, not too far from here. So please come and join us. I think it'll be a great meeting, and it's going to focus just on this, the community shock team aspect of how do we build shock teams, how do we build the infrastructure. Who does what? Who's the quarterback? Who takes care of the patient at what different stages of the care? And learn from what we did right and learn from what we did wrong. Yeah. None of us, I don't think, in the country can say that we do it perfectly, because every day we're learning. But I think that's what the communication, the mingling of the different minds, and it's a multidisciplinary meeting. Even though it's run by an interventional cardiology group, it's going to be well presented by interventional cardiology, heart failure physicians, intensivists, as well as cardiac surgeons. Yeah. So really important, I think, for us to put programs like that out there at all the major conferences so that we can really learn from each other.
Yeah, one of the things also, last question, is about MCS and what to choose what. I think this is also, we're very close to kind of define the problems and which ones received it before, but the data is still kind of not 100%
Absolutely
convincing.
It's going to be a very difficult area to get data. Even with the randomized trials that are currently ongoing, that just completed, the Danger Shock trial, as being one example, and you look at the trials that are coming up, and Recover 4, maybe will be another trial that Abumed's trying to put together, but there are a lot of shock trials that are trying to be put together to really show it. It's a tough area to recruit, tough to consent. These patients are not consentable when they're in shock. Who consents? The concept of community consent, and there are a lot of issues that need to really be brought to the forefront, and I think that's what we're trying to do in the community. But it's a great question, and I don't see the answer anytime soon. But I think we have to use the best practices and try to do what's right for each and individual patient.
Absolutely. Well, Dr. Perwaiz, thanks so much for your time and for enlightening us about the shock and creating that community. And again, Sky Shock in October coming up in Texas. Thank you so much for watching us. Please watch these videos and others on CVI YouTube channel. This is Perwaiz from Austin. Thank you so much.
Thank you.